Reefer madness seems to be overtaking America. Every year, more and more states are legalizing marijuana, and not just medicinally. Attitudes on marijuana, especially among younger people, seem to be towards liberalizing possession and usage for people that want nothing more than to get high. Many people are arguing that people should have the right to do with their body what they wish. But not everyone is thrilled about this trend, pointing to poor research on the long-term effects of cannabis, dangers of adding another legal vice to society, and how marijuana can short-circuit the lives of many younger people. So should marijuana laws be loosened, or do the demonstrated benefits not outweigh the risks? Our experts debate marijuana laws on this edition of Debating Health.
Doctor, please, don't you know I'm going fast?
Marijuana legalization is increasing throughout the United States, with now 7 states and the District of Columbia allowing marijuana for recreational use. Another 22 states allow marijuana usage with substantial restrictions. Either way, marijuana is becoming much more legally prevalent across America, with most of the southern United States having no provisions for legal marijuana usage. According to the latest Gallup poll done late last year, 60% of people in the U.S. favor marijuana legalization, and that's up from just 12% in 1969. This includes well more than 60% of adults under age 55, including a whopping 77% of those between 18 and 34 years of age. Included in that, more than 2/3 of Democrats and independents favor legalization. Even 42% of Republicans favor legalization. And that's double the number in that category just 1 decade ago. But the question is, are we moving in the right direction there? And if so, are we doing it too fast? Because marijuana has been kept illegal, quality, well-designed, long-term studies are at a minimum. So how do we know exactly what the health effects of marijuana, both positive and negative, are? And what research we have seen links marijuana with higher crime rates, worsened reflexes, and a propensity for using other dangerous drugs. So while research showing the benefits of marijuana is spotty and questionable, while research showing the negative benefits of marijuana is far more numerous, although the research in that area may be of questionable neutrality. But whether or not marijuana is a net positive or not for health, there are many things in society that also fit that description, whose usage won't land you in jail. So should consenting adults in this country be allowed to use marijuana even if there are potentially no provable benefits and very defined negative effects? Or is adding and legally condoning another vice, despite the potential additional revenue it can provide, a bridge too far for this country? Our experts will debate marijuana laws on this edition of Debating Health.
Hit me with your best shot. Come on, hit me with your best shot.
I'd like to introduce our first speaker who's in favor of expanded access to marijuana, Kat Packer, the policy coordinator for the California Office of the Drug Policy Alliance. Kat, thank you so much for joining us here today.
Absolutely. Thanks for the invite.
Kat, how has marijuana affected you personally?
I think it's affected me in a couple of different ways. I think that first and foremost, its illegality across the board has caused me to have a job, and I think that's important just because there are a lot of folks that don't realize that there's still a lot of need for advocacy in this space, because folks are still being criminalized for a plant in certain regions of the country, the same plant that is legal and profitable in other sides of the country. I don't necessarily think that cannabis has negatively impacted me in any way. I have more so seen the negative impacts that cannabis laws have caused different people, and being an African American and subject to heightened forms of criminalization and surveillance based off of cannabis. So I think, if anything, it has made me more vulnerable. The policing of cannabis has made me more vulnerable.
Kat, when we look at marijuana, would your organization, and you personally, if your views differ at all, pushing for decriminalization of marijuana and making it so you're just not going to get arrested for possession of marijuana? Or do you really want to see full legalization? Or is it kind of one and then maybe the other?
I think that when we start this conversation, also we talk about decriminalization. A lot of the times that is just focused on individuals who would possess marijuana. the problem with that is that decriminalization doesn't hit at the issue of the illicit market. Essentially, if you're going to have cannabis be decriminalized, that's not going to stop the supply of cannabis or the demand of cannabis that's going to take place. And if folks are continuing to buy and sell, essentially then the selling of cannabis can still be criminalized.
Yes.
And in some states, just having a certain amount on you would be considered intent to distribute.
Even under a decriminalization?
Absolutely. So, for instance, in 2011, California voted to completely decriminalize less than an ounce of marijuana. But the problem with that is that because police officers have discretion, they often use that discretion in biased ways. And so, someone might have an ounce and a half on them, and a police officer would say, well, that's intent to distribute. And another person might have an ounce and a half on them, and the same police officer can say, well, that's just possession.
Other than the criminalization aspect, other than basically stopping it so people go to jail solely for possessing marijuana, what positives would come from legalization that you see?
One of the things that we like to say here is that we know that in a legalized market, in a regulated market, folks are consuming cannabis. We know that not everyone is consuming cannabis. We know that cannabis consumers exist. But in a regulated and a legalized market, we can know exactly how much, how potent the cannabis is that folks are consuming. We know that we can test for things like THC and CBD. We know that right now on the in the illicit market, folks aren't checking IDs. It's a safer system so that so that children don't have access to cannabis. And again, I think that this is a conversation that's long term. When we talk about legalization, regulation, we've had prohibition since 1937. So I do think that we're talking about a long-term project and a long-term vision.
So when you talk about that, you talk about legalization, you're talking about promoting responsible cannabis use, putting it out into the open. So in your mind, what would a legalized cannabis society look like from a purchasing standpoint? Say I decided I wanted to go get some marijuana somewhere, or cannabis, if that's your preferred term. I'm not up to nuances, so I don't know the difference, and I'd be happy if you filled me in. But say I wanted to go get either one. What would the process look like for me to go do that if you had your way?
I think that it would kind of be like buying anything else that you would buy on the market. You would do research first. You'd be determining individually what are you buying this cannabis for? Are you a patient? Are you an adult who is using this for some other reason? Once you had that information in mind, let's say that you maybe you had trouble eating or you had trouble getting to sleep. Then you could find a particular type of cannabis. There are different strains of cannabis. There are different chemical compounds that are in cannabis, but you would be able to identify a product that would meet your expectations and whatever goals you were trying to reach through that experience. You'd be able to, as an adult 21 and older, walk into a store, interface with an employee of a store who had knowledgeable information about the products that were in that store. They'd be able to refer you to other products. They'd be able to tell you what was in your price range, and then you would be able to walk out of that store without any fear of criminality, without any stigma, and you can go home and be on your merry way.
So you said something very key there, 21 and over. So you would want it regulated like alcohol, not 18 and over like cigarettes. No prescription necessary like a prescription drug, really just kind of like we currently regulate alcohol.
I sometimes push back on folks trying to encourage for the regulation of cannabis like alcohol, just because cannabis and alcohol are two different, completely different things, and people use cannabis and alcohol for different reasons. Particularly because of how cannabis policy has developed here in the United States, There are both legitimate reasons for why someone would want to use cannabis for medical reasons, and there are legitimate reasons why adults would want to use cannabis for non-medical reasons.
I'm talking more about just the purchasing process, that I could go down to a store, I show an ID, I'm 21 and over, that's all I need. No
Right.
prescription, no reason. If I want it, I'm 21 and over, I should go to a store. Is that, in your vision, a store like here in Georgia, for example, where I am, I can go to CVS, I can get beer, I have to go to a liquor store to get liquor. Should I be able to get, say, cannabis in a convenience store? Should I have to go to a special cannabis shop? Again, how would you guys like to see that?
I do think that it needs to be in a store that is specifically for cannabis. I think that as this conversation is moving out, and as we're in the first couple years after prohibition, that it does make sense to restrict cannabis to locations where there's only cannabis. So your CVS example, you might be only going into CVS to get Band-Aids, but then you see beer, so then you get beer also. I do think that because this is a new product for some folks, and definitely a new legalized product, it makes sense to restrict access to areas where you're coming there specifically to get that. You're not going to be out and about trying to get something else and just so happen to see cannabis and then try to secure cannabis.
Why age 21 versus, say, 18?
Well, we do know that, and we're still getting information and studies and research on this, but non-medical cannabis isn't for children. We know that as folks and children have their brains developing, that cannabis could potentially negatively impact their brain development. And we want to try and reduce the amount of harm that come along with cannabis. And so one way to do that is to try and prevent children and young adults from getting their hands on cannabis.
How much marijuana should someone be able to buy?
I personally think that folks should be able to buy as much marijuana as they want. Now, I know that jurisdictions that have legalized marijuana have restrictions on the amount that you can possess and have on you at any given time. But part of that reason is that state jurisdictions and local jurisdictions are trying to prevent what they call diversion. And essentially that's, taking legal cannabis and taking it to a state that's not legal and selling it. So I think that some of the restrictions now that you're seeing on possession amounts, only being able to possess up to an ounce of cannabis, those may be appropriate right now. But as this conversation moves forward and other states start to legalize, and we're looking at a national conversation about whether or not there should be specific quantities of possession limits, I don't necessarily think that it makes sense to have those restrictions. We don't have those restrictions for alcohol.
Sure.
Alcohol is a much more dangerous substance than cannabis is. And you can go into a liquor store right now and buy enough alcohol to fill a swimming pool, and no one is going to say anything to you.
So let's say I bought 5 ounces. Let's say we set the line at 5 ounces of cannabis, maybe instead of 1 ounce, as I currently understand it. If I have more than that, and or I'm caught selling it to a minor, or I'm caught purchasing it, diverting it to a place where it's not legal or anything like that, are the penalties that we currently have for that sort of thing appropriate? Would you still believe that those penalties should be enforced if cannabis isn't used in compliance with the law?
A lot of our cannabis laws don't make sense. So I think that as we're considering changing cannabis laws, that we should always err on the side of trying to think critically about how we can reduce penalties for cannabis. That being said, there are still things that absolutely should not happen. You shouldn't be selling cannabis to a minor. So there should be appropriate measures and enforcement tools, educational tools, to make it so that folks are encouraged to not sell to minors and know that there are penalties if you are selling to minors. as far as taking and selling marijuana, diverting across state lines, essentially, it's what we're seeing right now is that there are certain jurisdictions in the United States where you can sell as much marijuana as you want, and the local jurisdiction is going to be happy because they're getting tax dollars. I do not think that it's fair that simultaneously on another side of the country doing the exact same activity could potentially land you in prison. I think that irony is one that has to end, and I hope that the conversation shifts as to allowing penalties for that type of behavior to be reduced as well.
So you want to see this done at the federal level, not a state-by-state level. Should states or localities have the options to keep marijuana illegal if they don't decide they don't want it in their communities?
I do think that it is a conversation that communities need to have. I think, unfortunately, a lot of the experiences that folks have had with past cannabis policies kind of stunt that necessary conversation. Sure. But I think that if a state is interested in legalizing cannabis, particularly for adult use, then I think that makes sense. If folks want to do that, we would like to see a federal legalization effort. I don't think that's likely. I think that the environment in which we're in right now, we're more likely to see a state-by-state basis. But because this is something that's coming on board for the first time, this is a new market, I do think that individual communities should have discussions about what that legalization process should mean for them. And if
an individual community, be it state, county, city, decided against that, you'd be okay with that?
I think that it depends. A lot of folks, if the conversation was robust enough, if folks said, well, we just don't want it in our city, then that's fine. And I think that there's also a difference between commercial cannabis activity and personal cannabis activity.
Say a state was willing to, say California, which is where you're based, was willing to legalize it, license, allow home growth. Where should people be allowed to consume it? Would you like to, is it fair? Obviously, people in their own home. Should there be places that just allow cannabis? And only cannabis consumption, like some of the cannabis cafes that took place in Amsterdam, for example? Would you allow them to sell alcohol or foods? Would it just be something that you could go into a restaurant, kind of like cigarettes, and they could have the marijuana section, the non-marijuana section? How, I guess, robust would you like to see the ability to consume it in different places be?
Yeah, I think that's an extremely important topic, and I think that certain jurisdictions are struggling with how to figure that exact question out. We know that legalizing cannabis in a sense isn't necessarily legalizing the consumption of cannabis. Essentially, for folks here in California, if you don't own your home, then you don't necessarily have access to consume marijuana when you want. There are a lot of folks here in California who rent homes, who might live in federal housing, things of that sort. And essentially, they don't have any place where they can consume cannabis, and that goes for adult users and for medical patients. That being said, if you don't give folks a place to consume, then the chances are that they're going to consume in public. And we've seen that happen in other jurisdictions. In jurisdictions that haven't allowed for places for folks to consume, a huge number of public consumption tickets have gone up. So essentially, it makes sense to create safe places where folks can consume socially.
Would you leave that to localities again to determine, whether again, some localities allow alcohol with food, some places have smoking sections, some places don't. Was that something that just the locality should be able to determine? You can smoke here, but not here. You can not smoke, but you can consume edibles in this location. You can only do it residentially. You can only do it maybe in this public area. Would something along those lines be okay in your view?
Yeah, I do think that on one hand, again, because this is a new product that's coming to market, it makes sense for local communities to be able to lead those conversations in their communities.
Let's look at one other aspect of marijuana. It's kind of the area I'm in, which is marketing. I do pharmaceutical marketing. Pharmaceutical marketing is very regulated. Everything with pharmaceuticals, they have to talk about the risk information. They have to post studies. You're very limited in how you can do it. You have to get approval on your marketing. Cigarette marketing is more restrictive even than that. Alcohol marketing is less restrictive. Where do you think marijuana should be allowed to be marketed? Should it be something where you could advertise it just about anywhere freely? Should be something that should be incredibly restricted and kept off television like cigarettes? Is it something that should come with warnings and risk information like pharmaceuticals?
I mean, I definitely think that it needs to come with education and risk information. A lot of folks don't know what's in their cannabis products. They don't know the effects of the products that they're using. So any type of consumer information that would allow responsible adults to make responsible decisions, I think is absolutely necessary.
But
I think that it makes sense to have restrictions on advertising and marketing that are reasonable. So I don't think that people should be able to misrepresent their products.
So looking at what people have said against marijuana, people talk about it as a gateway drug. They said it can make you be intoxicated when you're driving, can lead to more accidents. It could have long-term effects like potentially cigarettes. Like I said, it could lead you to try harder and harder drugs like cocaine or heroin. These aren't my arguments. These are positions I've seen people say. What would you say to counteract those positions as to why you should be able to we should allow another potential vice onto the market into the legal sphere?
I think that in having these conversations, we have to talk in terms of reality. So we know that cannabis exists. We have to determine what is the safest way for all communities to experience cannabis. What we've seen through decades and decades of the drug war is that the policies that we've had in place with just prohibiting cannabis has just meant that only people who are participating in illegal business activity get to reap the profits.
Sure.
We're not testing cannabis for consumer safety. Folks who are selling cannabis aren't IDing minors, and it hasn't curbed at all the use or availability of cannabis. And so all of these different things that you just mentioned, it's not that these things go away when we legalize cannabis, but I think that we can figure out how to manage these behaviors and maybe their unintended consequences more responsibly.
Last question for you. Suppose you're put as the new marijuana czar of the country, and you get to design the federal marijuana laws and how they'll look in terms of how people can consume, purchase, et cetera, et cetera. What would you like to see? I know you've answered a lot of these questions, but just, I guess, quickly to kind of sum up, if you could draw it up, how you'd like to see it done, what would it look like?
I think in the most basic sense, in a way that encourages responsible use, whatever that may look like, a way that doesn't send.
Well, be specific. It's your choice. So when you say responsible use, tell us what you see responsible use as.
I really think that it depends on the person. Cannabis is very different than alcohol. So even in terms of different strains, you can consume one type of cannabis and it can affect you one way. So responsible use might look one way for that particular type of cannabis. Edibles, for instance, responsible use of edibles is going to look completely different than responsible vaping and smoking. So I think the most important thing is just for there to be an honest conversation about what the harms associated with cannabis are, that folks who are interested in selling marijuana aren't penalized for that activity, that they are given access to economic opportunities. I'd like to see situations where folks who have past criminal records for marijuana offenses are given opportunities. A lot of folks get caught in their opportunities to have those tools that are necessary to be successful in this life are taken away. And so
because of marijuana possession or dealing.
Right, exactly. And so I think that that's how we make cannabis less harmful, is to make the actual policies and laws that try to regulate cannabis less harmful.
Kat, I appreciate it. Thank you so much for taking the time. I know I had a lot of rapid fire for you, but I really appreciate it.
No worries. Thank you so much.
Gotta keep them separated.
Discussing the issues against liberalizing drug laws is Scott Chipman, the Southern California chair of Citizens Against Legalizing Marijuana. Scott, thanks for joining us here today.
Thanks for having me.
Scott, I just want to know, how has marijuana affected you personally?
Well, in my own community, the reason I got involved in this is that we had stores selling drug paraphernalia, and then we thought, well, is this legal or illegal? We looked up state law. It's illegal to sell drug paraphernalia, and we started to get activated to try to get rid of that kind of merchandise from our community. Before we actually got engaged in it, we had a store open up selling marijuana itself. We filed complaints and with the U.S. attorney, city attorney, code compliance. Before we could really get any action, we had 3 stores, 5 stores. We ended up with 25 stores in our community of 37,000 people, a neighborhood of San Diego, 250 stores in San Diego proper. Not one of these businesses had a permit to operate. They were all basically just drug dealers behind a glass door. And that got me more and more interested as the years went on.
Was this ostensibly medical marijuana?
We don't see any difference between medical marijuana and drug cartel marijuana. We certainly can't tell any chemical difference. And yes, they called themselves dispensaries, but it was clear just looking at the advertising, Cheech and Chong art on the walls, drug culture images that, they're drug dealers. Now some of them who have been permitted wear suits and ties and try to make themselves look legit, but they're still just drug dealers behind glass doors.
Could you or I have walked into one of these stores and purchased marijuana, or would we have needed a prescription or any sort of card? Or
Well, first of all, you got to realize that there's no prescription for marijuana. So in California, and that's nationally, there's no prescription for marijuana because it's not an FDA-approved drug. So I got 3 medical recommendation cards myself, which is the pseudo permit
Sure.
to purchase marijuana in California. Never saw a doctor. I just answered free ads in the back of a free newspaper and went into one of the locations. Most of these locations may have 8 or 10 phone numbers and locations. No doctor is present. I said, well, they asked me, what's your issue? I said, pain. They wrote chronic pain on the documents, printed out the documents, the recommendation with the doctor's signature already on the document. So there was never any doctor visit. There was no physical taken, no blood pressure, no what's your medical history. Here are the warnings. This is the potency. This is the dosage. This is how often you're going to take it. This is when your follow-up visit is. There's absolutely no pharmaceutical protocols whatsoever regarding marijuana. We had a coalition member FaceTime with a doctor in Los Angeles area for 30 seconds and got a marijuana recommendation for anxiety while driving. This is the quality of medical care related to marijuana.
Were there any conditions given to you upon purchase about how you could consume it? How, where, matter, anything like
Nope.
that?
Any 18-year-old can get a card just like I did and buy any amount of marijuana they want. You can go to 5, 10, 15 stores a day. You can go 5 times a day. You can go the next day. And that is nothing like a pharmacy, nothing like a prescription where you go in and you turn in your prescription. You get a dose for a certain amount of time. You have to get follow-up visits and follow-up prescriptions. And that's not what we have with marijuana. Marijuana is complete ruse. It's the snake oil of the 21st century. And people need to wake up to the fact that they are, if they're permitting this, they're permitting drug dealing in their neighborhoods.
So as someone who works extensively in pharma, I know conventionally you're going to get a warning of potential side effects, potential interactions, nothing like that?
Nope, nothing.
Okay. So,
And by the way, the potency of the marijuana of today is 10 to 40 times stronger than it was in the Cheech and Chong era of the 60s and 70s. So we do have real medical marijuana in terms of FDA-approved drugs, cannabidiol, Sativex, Marinol. Those are cannabis-based drugs that have been FDA-approved. Their maximum dose is 10 milligrams, but I can go into a store and buy a brownie that's 250 milligrams of THC, which is you basically, if you ate one brownie, you would be overdosing by 25 times.
So go back to those drugs that you mentioned were legal. Say those were the only things being sold in those stores or in a retail pharmacy, Walgreens, CVS, one of those. Would you have the same issues then if the same protocols were followed and the same FDA regulations were imposed on those drugs as any others?
Well, the FDA restrictions are on those drugs, and you cannot get them without a prescription. You can't drive or use heavy equipment when you're using those drugs. They're for specific ailments,
Yes.
and they've been proven to be effective when used properly for specific ailments.
But if those marijuana-based drugs, as cannabis-based drugs, were put into the same test, the same rigorous things, found to be effective, I'm not saying they are, it's beyond my scientific understanding, would you then have a problem with them being sold?
We're 100% in favor of the FDA process. We support it 100% and would not be arguing if the cannabis-based drugs were being distributed through pharmacies. We would have no problem whatsoever.
Now in California, obviously I know they've passed it or semi-passed it or however you want to phrase it as a medicinal manner. I know in states like Colorado, Washington, it's hard to keep track now because I know the law is changing in a lot of states. They've gotten rid of that somewhat facade of legalization. Would you be more in favor of it if it wasn't promoted as a medical treatment, but merely something like cigarettes or alcohol or something else that people chose to do and licensed or sold it in that manner versus marking it as a medicinal thing, or does that not matter to you?
We're 100% opposed to using marijuana in any other form than an FDA-approved drug. The idea that marijuana was medicine was just a ruse foisted upon the public by the drug legalizers and by the marijuana industry itself. When Prop 215 was being promoted, the legalized marijuana for medical purposes in California, we were told over and over again, this was not about full legalization. This is only about seriously ill people getting medicine for end-of-life issues. And but the way it was written is you can get marijuana for any medical condition for which you think it would be helpful. And they used the profits as well as the illicit profits to lobby and to buy off politicians and to market and to buy off public opinion and then to get it legalized with Prop 64.
In the state of California or some of those other states that have legalized marijuana, either medicinally or fully, I don't know if legalized or decriminalized is proper terminology in every state, so we'll throw both of those in there. What negative effects have you seen in those states or have you seen documented in those states?
Oh, well, use is up. Use is up among every age group. The potency of the drug is up. The amount of use is up by individuals who do use. Alcohol use is also up. Illegal marijuana crimes are up. So people think, well, as soon as we legalize marijuana, we'll have a lot less people arrested. Well, first of all, decriminalization happened long ago in virtually every state. In California, we searched every prison and jail. In California, could not find one person in jail or prison for simple possession of marijuana. If they were in, it was for trafficking dozens or hundreds of pounds, or for violent crime while under the influence of marijuana, or violent crimes in connection with transport or trafficking of marijuana. Mitch Morrissey, the Denver district attorney, indicated that virtually every crime type in every neighborhood of Denver has gone up since legalization, and the police, the law enforcement efforts are spending more time and money and energy now on marijuana than they ever have in the history of the state.
What about the arguments that marijuana, keeping it illegal, costs tax revenue and that it leads to criminal elements selling it instead of more licensed stores like that? I mean, even in these stores, I'm assuming there's some kind of quality control versus just selling it on the street. Would you rather, is there any benefit that you see to bringing it into a more organized sales fashion versus just kind of the unfettered sales it was before any sort of legalization?
First of all, the black market has not diminished in Colorado or Washington State. They actually have increased. So there's more black market sales than ever before.
Why do you think that might be?
Well, because it's more prevalent, it's more normalized in the society.
But that makes sense for a seller. Why as a buyer? I mean, I'm not someone that uses marijuana with any regularity. I could see if it was available at CVS, I go in for a pack of beer and getting a little bit on a very small occasion. But why would I, as a seller, want to have to go through the process of finding someone with those shady connections and then having to meet some guy in an alley if I could get it legally, even if I had to pay a little more? You just think it's just a cost issue? Or do you think it's
It's partially the cost, but it's everywhere. When you've got houses being rented for thousands of dollars per month and turned into grow sites, and California produces 3 times more marijuana than it consumes. It's so prevalent out there, and the marketing, we're not sending good messages about marijuana. We're not really sending effective messages about drug use in general. But the message right now is, well, it can't hurt you. It's going to bring in tax revenue. It's a medicine. So why wouldn't everybody be using it? Why wouldn't we be floating it through the air conditioning systems? It's so good. That is the level of messaging. Out of every 100 stories about marijuana, less than 3 say anything about the harms, and the harms are considerable to the brain, to the lungs, to cancer. It is a known carcinogen. There's over 400 chemicals in smoked marijuana that do harm to the body. There's all kinds of impacts to the users and to the children of users, but there's also impacts, of course, to public health and safety.
Getting away from any perceived benefits of marijuana, what about the legal argument that consenting adults should be able to purchase and put into their bodies what they wish? Same thing that's true of alcohol, cigarettes. Do you think there's any consistency in keeping one illegal or not? Does it matter if there's any consistency?
Well, that's the same argument for meth, cocaine, anything. We know that there has to be limits. I mean, people say, well, we should allow anybody to do anything. You're not going to stop it anyway. I want to say, the drug war's been a failure. Well, so has the war against speeding on the freeway, right? So should we just eliminate the speed limit because people are going to go 70 instead of 65? We have to decide, what kind of society do we want to live in? Is there any argument that a society that has more people impaired, more people living in an altered state of mind, more people stoned in the workplace or even on the roads, is going to make a better society for us? There's no argument. No one can make that argument.
Aren't some of those positions, though, already covered by either current laws? If I go to work stoned, I risk my job. I mean, that's somewhat self-correcting. If I'm driving unimpaired, that's a crime already. I mean, I can buy alcohol, but there's very clear limitations on how, when I can use it. When putting marijuana under the same sort of legal regimen solve many of those issues?
It really doesn't, because the black market is so prevalent with marijuana. The black market's not going to go away. And what we have to be doing is sending the right messages to people. No one would disagree with the fact that alcohol is a tremendous burden on our society. We bring in about $13 billion a year in tax revenue. Binge drinking alone costs our country about $135 billion a year. We do not need to add another illicit drug. And by the way, 65% of the population drink alcohol during the years at some time. And only about 10% of them drink to get drunk, but virtually everyone who's using marijuana is using to get high.
So what would marijuana laws look like if you had free reign? And how is your organization trying to move you guys in that direction?
Well, of course, we would eliminate all legalization, and we would say if there is medical utility in some components of marijuana, let's get them approved by the FDA. We've got some drugs that are potential on the orphan drug status with the FDA now for seizure disorders. But right now, what's been happening with the so-called medical marijuana is that the drug legalizers have been using some anecdotal evidence that marijuana could have medical utility to argue for legalization of all marijuana under any condition, under any potency. So we would keep marijuana Schedule I drug. We would go through the FDA process, and we would not legalize marijuana for so-called recreational purposes. First of all,
I'm sorry, for our listeners, can you just clarify what a Schedule I drug includes and means?
Well, Schedule I drugs, basically botanical marijuana is a Schedule I drug because it has a high level of propensity for abuse, and it's addictive, it's harmful to the body, so it continues to be a Schedule 1 drug. It's been studied. Over 23,000 studies and peer-reviewed papers have been written about marijuana, and the conclusions year after year continue to be that it should remain on that Schedule 1 drug, which
what else is a Schedule 1? I'm sorry, just for comparison purposes.
Well, yeah, heroin, cocaine, LSD, they're Schedule 1 drugs.
Where would you draw the line between possession and trafficking? How much marijuana would I need on me to be considered I'm trafficking? If I smoked a joint with a friend, would that be considered trafficking? Would I have to actually deal him some? Is there a limit to how much you would consider to be trafficking?
Well, an ounce of marijuana is about 50 joints. So I'd say anything over an ounce is, but it would definitely be a criminal activity. I wouldn't necessarily put somebody in jail, but if you had pounds, I would definitely put you in jail.
So for those with less than that, what would you do? A fine, a reprimand, a treatment?
Well, the big thing we need to do is we need to educate people. The vast majority of people do not understand what's going on with the marijuana today. They don't know about dabbing. They don't know about hash oil. They don't know about the potency of edibles. They don't know about psychotic breaks, the impacts on the body. So the first thing we need to do is educate the public properly, which has not been done by the media. Horrible job. We need to actually get the science about marijuana out into the public arena and have a huge awareness program. That's what we did in 1979 when use of illicit drugs peaked at about 14% of the population. From 1979, for the next 25 years, drug use in the United States declined because the pressure was on, we've got to reduce drug use.
What is COM doing to promote those changes in education?
Well, we go anytime we're invited. We show up and we speak. We speak to city council people. We speak in public venues. We speak at church groups, community groups, town councils, everywhere. We are invited. We go and speak. We also have literature. We have a blog, website, and Twitter, and we go on programs like yours to inform people why they should not be in favor of marijuana legalization.
Nationwide?
Yes, we do. We work nationwide. We worked in Ohio, where we defeated legalization there, 65-35. We helped. We strongly urged the nomination and approval of Jeff Sessions as the Attorney General. We meet with U.S. attorneys in our own areas, and we're continuing to lobby this current administration and regarding enforcement needs.
Where do you think marijuana laws will be in the next decade?
I think that I hope it doesn't happen, but I think that the use is going to continue to climb. I think we're going to lose half a generation of kids who are going to have amotivational behavior. And, you have to realize about 1/3 of kids get their marijuana from their parents, which we consider this child abuse. The brain's not fully developed until about age 25. So any kid who's using, about 1 out of every 6 kids who uses, is going to become an addict. Our addiction rates are going to continue to climb. The number of people who are addicted to all drugs is going to go up until we get to a point where everybody's been impacted and they're fed up with it. And then they say, that was a huge mistake. Let's reverse.
Why do you think that's going to happen? Marketing, perception, lack of education? What's your opinion?
I think we're going to get more education. We're going to get more education out of this federal administration. We've had zero education on drug use, and that's why opioid addiction is going up, and a lot of that, 50% of the opioid addiction problems is being fed by people who start with marijuana. It's the first drug that our kids are being introduced to at about age 12 years, 4 months. Prior to alcohol and tobacco, they're being introduced to marijuana. And so, you see enough people go down, get off track, drop out of high school or college, and lose their way, and you say, we've got to stop this. This is bad.
Scott, I appreciate you taking the time with me today. Thank you so much.
Anytime.
So now you, the listener, what do you think? Was Scott Chipman right about the effects marijuana has on society? And would you want to see what happened to his neighborhood happen to yours? Or do you sympathize with Kat Packard, that marijuana laws ruin the lives of too many young people whose only crime is just wanting to consume cannabis? and that we'd be better off regulating it rather than keeping it banned. I want to hear your experiences with marijuana, how the laws work in your states, and what you'd like to see happen to marijuana laws both where you live and nationwide. We'll discuss your views on the next episode of Debating Health, where we discuss another controversial health topic. To express your opinions, please contact us by tweeting to @DebatingHealth, messaging us on our Facebook page and liking us there. Debating Health is the Facebook page. Emailing me directly at Scott Ehrlich at scott@ehrlichhealth.com. That's scott@ehrlich.com. Or check out our website at www.debatinghealth.com. That'll show you all our upcoming guests, my different radio appearances and TV appearances, and other controversial issues we may cover. Also, join us next time. And remember, healthcare is very complicated, so the best thing you can do is to take control of your health by being educated and understanding the issues. And there's no better way to do that than by listening to the premier healthcare policy broadcast, Debating Health. Thanks, and talk to you again.
Doctor, please, don't you know I'm